Now, perfect example of what happens when this system isn't being challenged is someone that I've worked with recently. They're fine when they're in buildings, but they get very, very nervous whenever they're outside. One potential reason for that is you've lost some of those reference points, i.e. walls, that you are using to help orient yourself in space to vertical. Okay, so we use our eyes a ton to maintain our balance. We also use something called the vestibular organ in the inner ear. I've talked about this quite a bit on this channel, so I've done a lot of in-depth videos on this. I will link some of those videos in the description below, but very, very simplified and brief. We've got these three canals that sit on different axes in our inner ear. They all have little crystals inside of them. And then there's little hairs that stick out from the walls on these canals. And when we turn our head in a specific direction, those crystals will spin in one of those canals. It'll stimulate those hairs. Those hairs stimulate a nerve that sends information to the brain that our head is moving in a particular direction. That is extremely simplified. Again, I've done full videos on that, but that vestibular system is sensory information going to our brain, giving it data as to where our body is in space. Very, very important. And then we have something called proprioceptors in our joints and in our muscles that sense when a muscle is being lengthened. That gives our brain information. So like, let's say for instance, we're bending to one side, the brain needs that information. We also have sensory receptors in our feet that sense pressure. When that pressure shifts to one side of our foot or the other, that's also extremely valuable information. All of that is super, super necessary and valuable to help our brain to figure out when we're vertical, when we're oriented to vertical, when we're not, and how to correct that to restore our body into vertical. And very important within our base of support.